Hi friends, this is a very simple case. In fact, it's a case of massive pulmonary embolism. You can see on the CT, on the CECT to be honest, you can see massive filling defects in the right and left pulmonary arteries. So this is a straightaway diagnosis. Why I set up this question is if you see this case, there are two things that I want you to pick up. One is on the ABG, you have a very low PCO2, which makes it a case of type 1 respiratory failure. So one thing I wanted you all to know is pulmonary embolism is associated with type 1 respiratory failure. In type 2 respiratory failure, we have a high PCO2 levels. That's how we usually differentiate both the types. So type 1 is associated with a normal or a low PCO2, whereas in type 2, you have a high PCO2 levels. That's the first learning point. The second learning point is in this patient, there is a low BP, which means this patient is in a circulatory collapse or an impending circulatory collapse. And what is the standard method of treatment based on the guidelines today? It is alteplase. So you have to start this patient on alteplase. Why not streptokinase? Streptokinase is a thrombolytic, yes, no doubt about it, but streptokinase has been shown to worsen hypotension, so it should not be given in patients with impending circulatory collapse. LMWH, that is low molecular weight heparin, can be used, but again, it should not be used in patients. I mean, it's not the mainstay of treatment in patients with circulatory collapse. If this patient was of a pulmonary embolism with a normal BP, then you could have thought of starting this patient off with low molecular weight heparin and then switching over to switching over to warfarin in case of chronic maintenance therapy for this patient. But I repeat, two learning points from this question. Number one, in case of a pulmonary embolism, you will find a type 1 respiratory failure usually, which has normal to low PCO2 levels. Number two is, in case of a circulatory collapse which is impending, you should always try going for IV alteplase and not streptokinase, because streptokinase is going to worsen hypotension. Thank you so much.